Hello dear students. In the last lecture we have started to learn about prescriptions and medication order, which is the last E point of unit 3 of subject pharmacy practice. In that we have seen what are prescriptions and what are medication orders, even though both are important linkage to have the communication in between the prescribers, that is doctors, and the pharmacist is the first linkage in between these both. Okay, the difference we have seen: prescriptions are generally meant for the outpatients and medication orders are for the patients who are admitted into the hospitals. Again, they are having various formats. They can be handwritten, printed, even verbal can be there. Okay, and these are the legal orders used for many things, for medication, devices, laboratory tests, etc. They can be OTC, uh, means they can be written for the drugs which are over the counter, as well as the legend or the prescription drugs which are called as. Okay, and we know the permission is needed for the prescription drugs, that is to be written or given by the licensed practitioners, whereas the OTC medications can be purchased by the public without prescriptions. Then we also covered that the medication orders, without having the complete understanding by the pharmacist, okay, they should not go for dispensing the medication. And for the evaluation of this medication order or the prescription, they have to make sure about everything regarding the drug, the doses, the frequency, route of administration, therapy, and the duration. Okay, different indications. So all these things are needed to be studied properly, and after confirmation that they are correctly mentioned in the prescription and medication order, the pharmacist should go for dispensing the medicaments. Along with that, the pharmacist has also go for the thorough information collection about the problems regarding the different uh, what it is called as a chances of the mentioning duplication or the say drugs of similar categories. Okay, drugs having allergies to the patient, interactions with both different drugs which are mentioned in the same prescription. Okay, similarly, they if go for all these proper assessment, they can minimize the problems. Okay, problems which are called as the harms, and they can maximize the effectiveness of the medicines which are mentioned in the prescription. The max detail information which is regularly known, generally included in the prescription, we know. Okay, name of patient, name of drug, its strength, its dosage form, and amount, quantity to be prescribed. Okay, direction for use, and also for the details of the prescriber or the doctor, like name, address, and signature of the doctor. In addition to the earlier information, there can also be the inclusion of date of issue, number of refills. Okay, these refills generally necessary for some drugs, scheduled drugs which are there. Okay, for that it is an important one. Okay, address or the date of birth of the patient, several times it is needed, and a special number is there of the doctor called as DEA number, Drug Enforcement Administration number. Okay, and if the drugs having the inclusion of controlled substances or scheduled substances, there are more stricter guidelines or regulations are there for it. Okay, just to have a proper control over their use in the prescriptions. Prescriptions for different pediatric patient should have the inclusion of age of patient as well as weight of patient, that also we have discussed, as the formula for calculating the proper dose for the children is generally depending upon the age and weight of the children. And veterinarian doctor should mention the animal species. Okay, the last slide in last lecture was medication order. Okay, this is different than the prescription, even though similar information should be included in the prescription as that of the medication order, like patient name, secondary identifier, that is date of birth. I also told that same name of the patient might be possible, so how to include the birth date of the patient. Okay, medical record number if any, then the social security number, then patient position or location in the hospital, what is the room number, ward number, etc., date and time of the medication order, and importantly name of drug, dose, route of administration, frequency and duration, along with the prescriber name and signature. Now this is the new slide. In the medication order, there are many examples by which it is can be ordered. Okay, the possibilities what we have to know, we should know about it. First example in that case is the copy of a written prescription. See, even though it is medication order, but it can be similar copy of prescription, along with it has having the information, additional information just we have discussed. Okay, should be mentioned in the same. Then it can be written order on a consultation form signed by the doctor. Okay, this is also type. Another type, that a doctor has written itself the indications about the administration and the all details in the medication order. Okay, but he has written that in the consultation form where the diagnosis is done, and what signs, symptoms and condition of the disease which are observed by the doctors were mentioned in it. Okay, then it can be medication order itself, which is written by the doctor and signed by them, okay, directly as it is. Then copy of pharmacy call in order given to you by the pharmacist. Okay, then in this case the medication order directly which has been provided by the patient to the pharmacist through the doctors who are there. Okay, then again another type of format is the verbal order. The orally the licensed person means the licensed prescriber, okay, who is giving a verbal order to the pharmacist or nurses or whoever the medical staff with respect to the medication orders. Okay, so it is another type. And nowadays this is also used in multi-speciality hospitals. Okay, the electronic prescriptions which are again signed electronically via a secured system. Okay, these by computer softwares which are developed by different hospitals for their own department or for their own organization, which uses the electronic way, okay, of supplying the prescription or medication orders which are there, okay, in their hospitals. Now another thing, when you want to interpret the what so called as prescription or medication order, Okay, in your syllabus they are mentioned the interpretation. Okay, we can say also translation or understanding of prescriptions or medication order. Many terminologies are there which are used in it. Okay, they can be in Latin, using Latin phrases, okay, or might be of different abbreviations which are included in it. So we must know about them, and we means the pharmacist should also have the understanding what are the meanings of these terminologies mentioned in the prescriptions or in the medication orders. So one of the important one, what is called as pro re nata, PRN, the shortcut which is used. Okay, it is a Latin phrase which is having the meaning in the circumstances. Generally in the medical field, okay, this PRN means as the situation arises, or when the need arises, or as needed. So this PRN, pro re nata, is actually used by the doctors when they are writing the prescriptions. PRN, because these prescriptions are only written as needed, or in the prescription what doctor is writing. Okay, when for example, if any sign symptom arises during the treatment, okay, the doctor says that one of the see, if we take the example, five medicines were prescribed or written in the prescription, doctor may say that this fifth number tablet should only be taken as needed. It means if you are having some pain, then only, okay, in XYZ organ, then only you should administer this fifth number of tablet. Likewise, they are mentioning that PRN over there. Okay, that is when it is needed. So this is only an example. Similarly, there can be many different uh, possibilities where that PRN can be written in the prescription by the doctors. So what is the next point? PRN medication orders. These are given definitely on as needed basis for specific sign and symptom. Just I told, see, there are many sign symptoms of many different diseases are there. So we should know about these signs, and if they are observed in the patient, okay, during the treatment, then only some XYZ medication should be given. So which is actually mentioned, they are called as PRN medication orders. See, many sign symptoms are there: tiredness, increased anxiety or agitation, headache, earache, redness or cut, okay, or scrap if it is observed over the skin, okay, coughing, sneezing, fever, itching. Okay, again, regular example, like you can say now nowadays, okay, when you are having some uh, runny nose, coughing, okay, and you go to the uh, doctor, okay, what he even is mentioning about the in the prescription, that they will suggest you some cough syrup, okay, so, some tablet for antihistaminics, and also they will be mentioning the antibiotic or analgesic medicine in that. So what they will be telling that even though now you are not having the symptom of fever or some pain in your body, okay, but if they are observed, then only you should go for the this anti analgesic or antibiotic drugs, okay, for the fever or for the pains which are there in the body part, if it is there. So this is called as PRN things. These PRN medications may be prescription medications or might be for OTC medications, for both. Okay, prescription as well as non-prescription medications both can be there for this PRN. Okay, not compulsory that it should be for only the prescription drugs. OTC medicines can also be written or included in this PRN medication orders. Okay, in order to give a PRN medication, you must have a medication order and a PRN protocol. Now, when the doctor is going for this medication, PRN medication order particularly, okay, they should have this protocol with them. What this protocol gives, okay, it gives a proper direction about how to administer the medication when it is needed. Now, definitely, what is there? What is the meaning of PRN? Okay, the medicine, that specific medicine, should only be administered when you are observing that particular sign or symptom. If it is observed, okay, what means as it is needed, only then it should be administered. And what the protocol says, okay, when administering this PRN medication, that PRN drugs, you must follow that medication orders or what the direction which are mentioned in the PRN protocol. Definitely, the patient should not administer the drug if the sign or symptoms are not observed, because they are not needed. Okay, at that condition, if the sign is not there, no need to administer that particular medicine. Okay, just I told the example of analgesic or antipyretic drug. If you are not having fever in that condition, no need to go for that paracetamol or any drugs. So in that case, okay, if it is there, then only you should administer that, and that what it is there. Okay, PRN protocol is needed for PRN medication orders. Definitely it is there, because unlike the medications that are ordered on regular daily basis, you have to know when the PRN medication should be given. It is obvious you cannot administer the PRN medication, okay, if it is mentioned in the medication order that it is a PRN medication. Okay, the PRN protocol gives additional information about the medication order and helps to understand when and how much of the medication to give. Okay, again, this medication or protocol, in particularly the PRN protocol, this gives the additional information, means not only the condition when it should be taken, but also how to administer. Okay, it is also mentioned, the first thing, when to administer, we know when the symptoms are there, at that time it should be administered definitely, but how much medication, the quantity, okay, the doses, the duration or the frequency, these things are also mentioned in the protocol. So the details about the administration of the medication will be known to the patient along with the pharmacist, definitely, okay, through the PRN protocol if it is there. Okay, only the prescribing practitioners or the nurse trainer can write or approve the PRN protocol, definitely, because they are understanding the details about the protocol, when to administer, okay, which drug by the patient depending upon the condition of the diseases, because uh, they have diagnosed, okay, they have checked the patient properly, and they are aware with the conditions of the patient. And definitely the doctor, or so called as prescribing practitioners, as well as if the nurse who is there who assisting the doctor, can be having the uh, what we can say ability or authority to approve the PRN protocol, and if it is there, we must follow the PRN protocol exactly when giving the PRN medication, because if it is not followed, there might be problem arising with the patient, or there can be some complication arising in the there might be drug in what it is called as a level of extent of sufferings which are there in the patient can be more severe if you are administering the medicines unnecessarily, okay, or if it is not needed, what it is called as. Hence it is should be given only when needed or as needed. Hence PRN protocol must be followed. Now what the PRN protocol should include, okay, there are again similar things. See, all of the information found in the medication order, okay, definitely see all the things what we have seen earlier about the medication order, details of patients, details of the prescribing practitioner who is called as doctor, so their information definitely it is there. Along with that, that is plus what you have to mention is a specific sign and symptoms that medication should be given for. Means again I am repeating, just I told, when if you are having fever, okay, then only go for that extra tablets of paracetamol or antipyretic drugs which are there, okay. So the specific sign and symptoms what see we have listed over here, these, see, tiredness, anxiety, headache, coughing, sneezing, these, any of this if it is there, or there can be different sign symptoms, these are only examples, okay. So if it is a PRN protocol, there should be proper inclusion of this signs and symptoms of the medication. Then maximum daily dose again should be properly mentioned, okay, it should not exceed the doses, okay, there should be only a specific amount, okay, and we have to calculate the maximum daily doses to be given and should be mentioned in the PRN protocol. Then you can also have the inclusion of any specific instructions, like important thing, when to call the nurse or the doctor, okay, that is prescribing practitioner who is called as, okay, uh, when to call means not the timing, okay, at night should not be called, like not like that. You have to mention that if the condition of the diseases, okay, if these signs are observed, then you should call to nurse or the doctor or the prescribing practitioner. If so, that is XYZ sign is not observed, no need to get harassed, or tension should not be there, okay. If such problem, if any of the sign symptoms are observed, then only you have to call to the nurse or the doctor. So you have to mention that, that is called as specific or special instructions should be mentioned in the PRN protocol to give a proper alarm for the uh, patient, that they can go for asking the nurse or doctor. See, every medication order which is there, okay, for any individual, you must get answer of some important questions before you give medication. This is for the pharmacist, definitely, okay. The pharmacist should understand the medication order definitely before again dispensing the medication. They should go through some questions, they should get the answers of the medications questions which are should be asked for by himself, that, see, which are the questions, what is the name of medication, definitely, okay, which is mentioned over there. The name should be properly read, yeah? And if it is written properly, then only it is readable, that is handwriting of the what so called as prescriber or the doctor should be proper, because we know, okay, many of the doctors were not having good handwriting, or they are not using readable handwriting, okay, only the pharmacist can understand. So the name of the medication should be properly known, okay, or should be readable by the pharmacist. What is the next question? What is the purpose of medication? So purpose means for what disease it has been given, okay, or what, for what problem the medication has been written in the medication order, that should be known, should be understood by the pharmacist through his knowledge and skill which is there. In the same, what is the medication supposed to do means the same, that is uh, after administering the particular medication or drug, what will happen to the patient, what the problem are there in the patient are will be cured, okay, or will be treated. So that should be known, and which is actually the purpose of the medication. Further, what effect will the medication have on the individual, means effect means the how it is going to work in the patient, okay, it should be known by the pharmacist. Another question, how long will it take the medication to work, means the timing, for how much period, or the medication will be showing its effect on the patient, as well as for how much period it should be administered by the patient to get complete cured from the disease. Like it can be in hours, it can be in days or weeks, okay, so depending upon the condition of the disease, whether the in the prescription or in the medication order the prescriber has mentioned correctly or not about the duration of the dosing should be, which is given to the patients. Next question is, what are the side effects or adverse reactions or signs of overdoses of the medication? Okay, again it should be known by the pharmacist, because with his knowledge and skill which is there, okay, there can be many conditions like with the sign and symptoms which are there if the medication are administered in excess, okay, if there is by mistake the patient, if administering more medication, what may happen to the patient, along with even if the regular dose which is administered, they may show some side effects. So the pharmacist should be aware about these things, that this and this effects which are called as side effects of these medications which can be observed, okay. Similarly, some adverse reaction may be there. Then any of the problems in the different conditions which are analyzed by the laboratory tests, like the blood levels or other testings in the serum which should be done, okay, and it should be properly monitored by for assessing the adverse reaction or side effects of the medications which are mentioned in the prescription or medication order. Next question, are there any interactions with the medications that individual is taking? So there are chances, some of the interactions which are there. So it is depending upon the individuals medications, are there any medications that will be having interactions in between? Because uh, all prescriptions will not be having the inclusion of such drugs which are having some interaction with one another, what it is called as drug interaction, okay, or drug disease condition interaction. So these interactions, if possible, whether they are there or not, it should be again checked by the pharmacist. Okay, that is the sixth question should be arised in the pharmacist mind. And lastly, another question should be arised is, are there any special administration or storage instructions for that particular medication which is mentioned in the prescription should be followed? Okay, because many medications are there that should have a proper administration time. Okay, see for example, uh, when you are generally administering the antacids or for antihistaminic drugs, importantly, okay, they should be administered before meal, okay, before eating or before lunch or dinner, what it may be. Okay, those antacids, it should be administered at particular uh, time. And similarly for many drugs, again for example, the antibiotics are generally asked to be administered after meal, so that is there. So these are called as special administration orders. Okay, then again, whether it is needed to be administered with milk or with water, okay, that is there. Then whether the medication which is mentioned, that is drugs which are uh, in the category called as controlled medication category, that has to be checked. Whether the storage conditions, like needed to be stored in refrigerator, if it is there, okay, if any medication is mentioned in the prescription or medication order that needs a lesser temperature, so the pharmacist should tell to the patient while dispensing that this one in the amongst all the medication should be kept in refrigerator, okay, just to uh, make it in a proper condition, or in a what we know is to have its proper effectiveness should be shown. So these are few questions should be arised in the pharmacist mind, and they should be got cleared by himself, and he has to tell all the things to the patient if they want to get a proper effectiveness. Okay, we'll be stopping over here. Next point we'll be discussing in our next lecture. Thank you, take care.